Why do runners get knee pain, and how do we prevent it? Hi, I'm Dr. Morgan Riggins. I'm a physical therapist at Opal Movement Therapy, and today we're going to talk about why knee pain is so common in runners and what we need to do about it. Knee pain in runners is pretty straightforward, and a lot of times there's a lot that we can do to help provide relief and to help prevent it from irritating you on your future runs. And as a runner who's had a history of knee pain, and now I don't have knee pain, I really can resonate with some of you because it's really frustrating when you have a goal or you want to run a certain amount of times a week or you want to train for a race and knee pain is getting in the way. And unfortunately with running, a lot of times we have little aches and pains, and it's very common where it's like, oh yeah, I feel that. And then sometimes some little soreness that we acknowledge but don't do anything about over time becomes a true knee pain or knee injury that then gets us out of the running game, which can be really frustrating. But anytime we have a runner with complaints of knee pain, the first things we're going to look at is how are they moving, right? So we'll say, hey, let's go ahead and see you do a squat. And we'll look at the squat, and we're going to look for a couple of things. We're going to look for, do the knees go in or out from the side? Do they bend at the hips and then the knees, or do they just throw the knees forward? That gives us data on how does this person like to move, right? If we see that the knees dive in, we're going to be considering, okay, is there a weakness or lack of control up at the hip? Is there a mobility issue at the ankle? If we see here that the knees just go right out the gate and we're not utilizing the hip, then we're going to look at how they perform other movements. And then, because running is a single leg sport, when you land, when you run, you generate 3 to 5 times your body weight in ground reaction forces. That is a lot of load, right? So we need to see how does single leg stuff look. So we'll have them balance on one side, right? And we're looking for, were there big changes? When they went from 2 feet to 1 foot, what changed, right? Or did it look okay? So here my hips are level. My hips, my knees, and my second toe are stacked vertically. When I go to one side, I want to see, did the knee start to twist in? Did one hip drop? Did I start leaning a bunch, right? And then we'll compare to the other side and we'll see any big differences. And we often film this because it's hard to see it all at once, and we really want our running clients to see it as well. You may be like, no, I'm perfectly straight. This is where I always am. You see it on video and it's like, oh, that is a little different. We also like to look at it from the back. There's a lot happening in the front of the body, but here we have these lovely little hamstring tendons, and it's easier to see in shorts, but we can kind of appreciate how when I go from 1 foot, there shouldn't be a lot of changes. If I'm twisting in, then we'll see that knee kind of corkscrew in from the back view. Once we look at single leg balance, we want to look at their ability to do a quarter squat. So when you balance on one leg and then do a little quarter squat, what happens, right? Do the hips stay still? Do they stay facing forward? Are they level? Does the knee stay stacked vertically between the hip bone and the second toe? Or does it start to dive in? Do they lean over? We're going to look at all of those things, and then we're going to do some follow-up testing to see, well, is it diving in because the back of the hip isn't performing? Is there a mobility issue in the hip? Is there a mobility issue in the ankle? Are they actually mobile, super strong, and they just don't know how to turn on the right muscles when on one leg? And then we're also checking in on, did any of that light up their symptoms, right? If they do their quarter squat and they're like, yeah, feel it right here, that gives us good data for like a test retest. Then we're going to look at, okay, what's the situation up at the hip? What's the situation at the ankle? And then we're going to check the knee, of course, as well. But hands down, whether it's the knee joint, whether it's the meniscus, whether it's a nerve in the knee area, whether it's the fat pad, 99.9% of runners have an opportunity to improve this. And that's why, as PTs, we kind of like working with you because, you know, there's a lot we can improve. If you're out there trying to run 2 miles, 3 miles, 10 miles, a marathon, an ultra, if you get on one leg and this happens, we're like, oh, we got work to do, right? It's different. If you come in, you ace everything, then we're like, well, how are we supposed to help you? But we like working with runners, and a lot of runners seek out physical therapy because of the demands of the sport. It's high impact, and most runners just want to run, right? I get that, right? I don't necessarily want to do all of this work outside of running just in order to run, but because running is such a high impact sport, we need strength and resiliency in our tissues to tolerate basically hopping on one leg over and over and over for thousands of reps during a run. And so that's why we just look at, okay, single leg quarter squat, what's the integrity of that? Are they stacking well? Is it uncomfortable? That's going to give us a lot of information. Then we'll do some more testing to figure out, like, is the joint irritated, meniscus, nerve, etc. But at the end of the day, regardless of the tissue, if they are collapsing on one side and the other side is staying nice and stacked, or if they're collapsing on both sides, we have to address the movement, right? Because that over and over and over is what adds to overload at the knee and can impact those various tissues. So we got to correct it, right? Now, what is one of the reasons that the knee likes to dive in? We have hip muscles here at the front of the hip and at the back of the hip that help promote stability of the hip. And the muscles in the front pull it into internal rotation. The muscles on the back of the hip underneath the glute that run horizontally, they pull it out into external rotation. So we've got hip internal rotators, hip external rotators. We want them to perform equally because they will keep the hip stacked and spinning right in the center of the socket. If the muscles on the front of the hip are performing better than the ones on the back, the body takes the path of least resistance and that hip and knee will dive in. Now, if everything dove in, I would just fall down, right? And most of our runners are not falling down, they're just having knee pain. And it's because when the hip and the knee dive in, our shin will rotate out to counterbalance, and we get this torsioning effect, and that can irritate tissues in the knee. So we want to limit that torsion or shear on the knee, and we have to address the strength up at the hip, the stability at the hip, and then mobility at the hip, knee, and ankle. And so a lot of times we find that muscle imbalance is very common. One of the reasons it's really common is that the ones in the front of the hip that do internal rotation, they're also hip flexors, which means they work when we're sitting, right? A lot of us sit a bunch, and so we get more action on the front of the hip. We're better at hip internal rotation. And then when we're sitting, our hip external rotators or the back of the muscles on the back of the hip are sleeping, right? So we've got this little bit of tug of war between the two, and the front is winning, right? So we need to address that in order to impact what's happening down at the knee. First, we got to get comfortable on, like, where do these muscles live? How do we control them? Because the thing is, if you're not aware of them and the hip is always diving in, then you never have a shot at turning the one on the back. Like in this position, if my hip is always rotating in, then these muscles are not in a position to work well. This is what we call passively insufficient. They are so long and stretched out right now that they can't fire as well. Whereas if I can get my hip into neutral, now the back of the hip and the front of the hip are positioned well to contract. So one of our favorite drills is finding hip neutral. You'll take your hands, you'll make a C shape, and you'll just grab onto your thigh. Not up here at the hip, you're gonna slide down, and you're gonna move your fingers a little bit to the outside. My feet are gonna stay still, I'm gonna gently twist my hips in. And when I twist them in, I can feel muscles popping up into my fingers. If you don't feel them right away, move your hands out to the outer part a little bit, and you'll feel it pop up. Right there, we've got tensor fascia lata, TFL, big hip internal rotator, very dominant muscle, loves to work hard. It's gonna pop up right into your finger. On the back of the hip, my thumb here, if I slide it down, it's gonna live on those hip external rotators that turn the hip out. So I can do the same thing. When I twist the hip in, I don't feel anything under the back of the hip. When I twist the hips out, I can feel it tighten a little bit here. Keep in mind, these are small muscles living underneath the glute max, the biggest butt muscle. It is not gonna feel rock hard like a bicep. It's gonna be like, oh, it's just squishy versus a little bit of tension. And so finding hip neutral can be really helpful. You rotate your hips in, you rotate your hips out, and if we have a side that's been problematic, I want you to pay attention, like, do you feel the out of the hip turn on, right? When we do something like a single leg quarter squat, if my hip's already diving in, then the back of the hip external rotators on the back are not present. And so what we're gonna do, we'll do a little drill now that you've gotten comfortable with hip internal, hip external. If the hip and the knee are diving in, then we need more external rotation. So before you do anything, you're gonna gently rotate the knees out, and you'll feel that little hip external rotator kick in. If you don't feel it yet, then a little hip hinge can be helpful. This puts the hip external rotators and the glutes in a little bit of tension, and I can feel this is a little bit taut. And so you can hinge a little if you need to. Now the challenge is, how do we do that when on one leg, right? So you're in this position. You have twisted the hips out just a little. I don't need you out here, right? That's going to cause other problems. So just enough to feel like there's a little trampoline tightness on the back of the hip. Now I'm going to focus on my right side. I'm going to lift my left heel off the ground. That put more weight on my right side. And I can feel my right hip having to work a little harder. I'm going to show you from the back too. So here, I'm hinging a little to pre-tension. I'm rotating out with the knees. I can feel the hip external rotators, they're active. I lift up my left heel. My goal is to not lose this. If I lift it up and I start rotating, then my hip's diving in, I've missed the goal. So instead, I'm trying to see, can I place the hip in a nice neutral position? Can that muscle stay on as I lift this? This is a really good starting point. If I do well with that, then I will start to shift my whole body weight because I got to go from 2 feet to 1. And now I can do little taps. And I'm not thinking about my left leg very much. I'm thinking about this right back of the hip staying on to prevent my hip knee from diving in. What I don't want to see is this. This would reproduce the problem. Instead, I want to just train the stability here. Now, if that's going well, I could add a band. I could turn this into sidestepping with the band where I'm really focusing on that muscle kicking in. We like that exercise a lot when done well. I can also make the test become the treatment. So that single leg quarter squat, we know that when done poorly, when the hip and knee dive in, adds stress to the knee. When done correctly, can become a very effective treatment. So let's talk through the setup. We're here. We're doing a little hinge if needed. We're rotating out. This hip external rotator is already on. I'm going to think about lifting the heel. I can feel how this already had to kick in more. I am going to shift my weight a little bit because I'm going to go to a kickstand. I brought that left toe back a little bit. And now I'm going to do a little quarter squat with a kickstand, like so. From the side view, it looks like this. I've done a little hinge, I've twisted out, I shift here, and notice my hip is bending too. That's the other thing we see a lot. You know, the diving in is by far most common, but also some of us aren't using our hips as well, and we're just bending the knee like this. That puts all the load on my knee as opposed to hip coming back. So when we do the quarter squat, and you're like, okay, I corrected the twist, it still hurts, pay attention to, are you just throwing the knee forward, or are you sending your booty back a little bit, head forward? Are you hinging at the hip and then loading? This is hard. I mean, I do this all the time. I lift heavy weights. I love strength training. I'm a meathead runner. A meathead marathoner is my self-proclaimed name. But right here, I have no weight, and my back of my right hip is like, hello. My ankle is also working. So thank you, YouTube. This is my therapy for the morning. Now, if that goes well, I could progress this to single leg, and most often we're going to need a little support to start, right? You're learning how to retrain your movement. If your hip and knee are used to diving in, if you go all the way to one leg, it may be very hard to correct it. So I recommend holding on to something, still thinking about those steps, right? Twisting out, making sure it's on. You could monitor on one side. I'm going to lift my left leg now, and now I'm going to do full single leg. But I want to put myself in a position where I can be successful. If I'm not ready yet to, do it hands-free, then it's not going to help the issue. Now, say I'm working at this for a while, and then I can just do like a fingertip, and then over time I can float it. That's going to be great because, of course, running, we're not holding on to things. Now, there's two approaches that we need to take with this. One, we've got to clean up the movement, right? We need to make sure that you can do quarter squats, staying nice and stacked, and we also need to load it. And so it can be very helpful to make this more of a strength exercise. Right now, this is what we call like a control type movement. We're learning how to control it with better muscle activation, better mechanics, but then we need to load it. And so we can make this harder by doing a reverse lunge because it's a lower range of motion where we just step back. It's the same mechanics. My hips are level, my hips, knees, second toe are stacked. I could turn to the side so you can see how I'm still hinging at the hips. I'm not gonna lunge like this because then I would be training myself to run in rear wheel drive. I want to propel myself forward. So I'm gonna lean forward because that's more similar to when I push and drive through when I'm running. I could add dumbbells to that. I could hold a weight to make it harder, or I can make this more of a single leg focus by elevating my back foot here. And now, same concept, I'm gonna think, okay, hips are level, hips are facing forward, hip, knee, toe. And notice, I was back here, right? Because I wanna put weight on that box to balance. That would have me run in a rear roll drive. So instead, I shift forward. Now I'm hinging at the hips. And this is a little bit harder because I took weight off of my back leg, puts more weight on my front leg. I could add dumbbells to this. I could add a kettlebell. I could work up to doing this with a bar on my back. Lots of ways to load it. But sloppy strength work isn't helpful, right? So we've got to start with the beginning of what do I learn how to turn on in order to do this with good mechanics. And then we want to carry it over to other exercises. So there's lots of great, strength exercises that are helpful for running. But if I'm doing them and I'm reinforcing the poor movement pattern, that's not helpful. So for example, like a step up, if I go to do a step up and my knee dives in every time, then I'm just reinforcing the faulty movement pattern. Whereas if I slow it down, think about the back of the hip, really focus on the way up and the way down, this is more therapeutic and is going to reduce stress on the knee. And then I would want to build that up with load, right? This can be a tricky concept, but it's one of the reasons why we love working with runners and they love working with us, because it makes sense. It's like, oh, yeah, that can't be good. No wonder my knee is unhappy. And then we just need to figure out, well, is it really a strength problem or is it just an awareness, right? Do we just need to get you to turn on the hip muscles and stack better? And then the cool part is we just turn it into a strength workout. And it can be really effective for running. For example, what I just showed you, that progression from basically single leg balance with good mechanics and like little distraction movements like taps, that turned into the quarter squat, which turned into the reverse lunge, which turned into the rear elevated split squat. If I worked my way up to split squat, I need to do split squats. That's going to hit my glutes, my quads, my hamstrings, a little bit of calf. I could do single leg calf raises. And I will point out my hip and knee might want to dive in on this too. So for example, if I just say, hey, do single leg calf raises, you'll do them, but you might be rotating in and reinforcing that movement pattern. So instead, we'll do a couple double leg, and I'm making sure I'm a little bit aware of that butt muscle. I could even twist out a little before I go to make sure it's on. And then I'm going to go stepwise. I'm going to go to a staggered stance, and I maintained that stack. And truthfully, I cheated a little bit. I floated it right away. I could even leave that foot down, and then I could float it and do single leg. Then I could add load to this. But it's how you do what you're doing rather than just doing it, right? Doing sloppy strength work that reinforces the hip and knee diving in may lead to your knee pain when you're running. So we want to clean up the quality first, then we want to slowly load it, and we want to progressively load it to the point where we can get closer to that 3 to 5 times your body weight, right? We want to be training with added resistance, but it's going to be a lot more comfortable if we do it with good mechanics. So stay tuned. We'll make more videos about strength training for runners, specifically to help with knee pain and other areas of concern. In the meantime, if you like this video, hit subscribe or follow us on Instagram. We post videos every day, and we just love to help get resources into your hands.